Debra Patt. I'm an oncologist here in Texas. I practice in Austin as a partner in Texas Oncology, and I'm here representing the Texas Medical Association, where I serve on the Committee on Cancer, and to try to improve the public health of Texans. So it's my great pleasure to be here today to talk to you about minority cancer awareness, and I'm really happy to see so many people with an interest, and I'm really happy to see such support, such legislative support for such an important topic. It's something that is near and dear to my heart as I see it every day in the clinic, and I'm happy to try to promote awareness around it. So just so I know, is there a way up here that I could advance my own slides, or do I just ask? We're going to talk about some trends that we know are true with cancer among minorities. The burden of the morbidity and mortality is much higher among minorities for cancer. There are access to care issues that is a particular issue in Texas. Treatments can be different in terms of efficacy and toxicity, so not having enrollment on clinical trials or not having robust enrollment on clinical trials among minorities remains a challenge. And then cancer screening remains an issue because of a decreased incidence of cancer screening. Oftentimes there's a later diagnosis than when cancer occurs at a later stage. It's then more difficult to treat, oftentimes requires more advanced treatments and has less chance of curative treatment. Next slide. So we know that minorities often will present on average with higher stages of disease. That late presentation, as I mentioned, translates into inferior outcomes. And often that can be due to barriers in education. It can be due to barriers in behavior, barriers in screening, and then appropriate access to treatment when symptoms do arise. So what I'd like to do for you today is to characterize disparities in cancer care among minorities in Texas and to discuss some of the causes of those disparities. I'm going to talk to you about some patient scenarios and understand what we can do to improve this situation today. So cancer is a leading cause of death among all individuals, but it is particularly high among minorities. We're going to walk through very quickly some slides here. So what you can see here is the leading cause of death by race and ethnicity in Texas. And I should just say that these slides of data that I'm just going to show you to illustrate the point in Texas are courtesy of Dr. Melanie Williams, who is the director of the Texas Cancer Registry, where I serve on the advisory board for 7 years now. But it's a tremendous resource for us who try to fight cancer in Texas to know about our own data. So what you can see here when you look at the cause of death, so up on the top you can see non-Hispanic, white, black, and Hispanic individuals, and look at causes of death. And you can see among Hispanic individuals that cancer is the #1 cause of death, and among non-Hispanic, white, and black individuals that cancer is the #2 cause of death, only secondary to heart disease. Next slide. This is the leading cause of death among males of cancer-related, the leading causes of cancer by ethnicity among males, and you can see that prostate is #1 and lung is #2. Though, as Dr. Lakey mentioned earlier, lung is the #1 cause of death. Next slide. And females, the breast is the most common cancer, second to that being lung cancer, though again, lung is a greater cause of death. Next slide. So when you look at the leading causes of cancer death by race and ethnicity, you can see that lung is #1, and so that's true across all racial groups. Next slide. And that for females, it is lung in Hispanic whites and blacks, and then among Hispanics, breast is only leading lung by just a little bit. So again, our major burden here is lung cancer. Next slide. So this is the relative risk of developing or dying from cancer in African Americans compared to non-Hispanic whites. And so if you see the first line across, it's the horizontal line across, that's 1. And so that's sort of where your relative risk would be in comparison to. And you can see that the risk is much higher. For various cancers in comparison to that reference point. Can you advance to the next slide? And this is the relative risk for Hispanics, which is actually lower for many tumors except for cervical cancer. Next slide. This looks at incidence rate ratios of different ethnic groups. And you can see that African Americans have a higher incidence of cancer with a ratio of 1.1, so again with your reference being 1. Next slide. And incidence of all sites for Texas males, again higher among African Americans. Next slide. And all sites higher among African Americans. Next slide. And this is among females, where you can see that it's actually very similar. Next slide for all cancer sites. And for colon and rectum against for males in Texas, it's higher among African Americans. Next slide. And for colon and rectum for females, it's higher among African Americans. Next slide. And this looks at lung cancer among Texas females, and it's actually similar. Next slide. And then for prostate cancer, higher among African Americans. Next slide. For breast cancer, it's similar. Next slide. For cervical cancer, higher among African Americans. Next slide. And for all sites for males, higher among African Americans. For mortality, next slide. Mortality for females also higher among African Americans. Next slide. And this is colon and rectum. You can see higher among African Americans. Next slide. Actually, I'm going to have you go ahead and advance. Go ahead and advance the next one. And the next one. You see a recurring theme here, so I'm just going to go on. So you see a couple of trends. One, that cancer is more common among minorities, but also that it carries a disproportionate weight of mortality. So it's more likely to translate into cancer death. And again, that's most often because of a presentation at a later stage of disease, and then difficulty sometimes in accessing appropriate care. And so I think that to the question of the later stage of disease, that can oftentimes be overcome with appropriate screening. Next slide. And so what this looks at is, this is just a summary of national data, so from the American Cancer Society, looking at survival of cancer types among ethnicities. And you can see among white individuals, it is substantially more favorable than among African Americans. And that's really by every tumor type. Next slide. This is cancer death rates by race and ethnicity for men and women. And you can see that in general it's much higher among African Americans when compared to whites. And these are death rates, cancer death rates by sex and race. And so you can see that the top line is African American men. Next slide. This is current cigarette smoking prevalence among high school students. So just to bring it back to the prevention point, that smoking among high school students remains an ethnic disparity and does remain a common problem. Next slide. And prevalence of mammography among the incidence of compliance with screening mammography among the uninsured remains a challenge that delays care. Next slide. So we know again that minority patients will often present at a later stage or more often than average. And this means that their cancer is less often curable. So I see this daily in my practice, and I thought I would tell you a little bit about that. Next slide. So this is the patient, Judy. I'll tell you that she's one of my favorite patients, but I have to say that I have many favorite patients because I love my patients. But Judy presented at 37 with a new breast cancer, and it was very difficult when I saw her because she had a large breast cancer in her breast. She presented with a stage 2B breast cancer, so it's still early stage breast cancer. But she had actually known for many months that she had a cancer in her breast. And she had not presented because she didn't have health insurance. She didn't have access to care. And so that led to a delay in her diagnosis. So it was several months that she had that she'd known that she had a problem. Next slide. When she decided that she would change her life and go back to nursing school and come back to be a cancer nurse, the day she told me she was accepted into nursing school, I palpated lymph nodes in her axilla. That meant that she had recurred. After we'd sort of begged, borrowed, and pleaded and gotten donated treatment, she had recurred. And unfortunately with an aggressive type of breast cancer that took her life this last year. And I'll tell you that her situation is not unique, because when patients present with later stage disease because of delays in diagnosis, it is more often that they will not be cured of their disease. Can you move forward to screening? So go forward, keep going forward. Keep going forward. So sort of wrapping up how we can improve, can you go back one to cervical, is that there are some major screening points that we can improve upon to prevent cancer. You know, cervical cancer screening is very clear. People need access to cervical cancer screening. It's completely a preventable disease. We also have vaccination now against human papillomavirus. Next slide. Breast cancer screening is important. Annual mammography and breast exam among average risk women, and higher rates of screening for higher risk women. Next slide. Colon cancer screening is important. Some people should undergo some form of screening every 5 years. Next slide. Prostate cancer screening should be discussed with your doctor. Next slide. And lung cancer screening, which is I think where we have new improvements. So now we understand from the NSLT screening trial that individuals with a greater than 30-pack year history of smoking, by having annual CT, low-dose CT, can have a 20% reduction in their mortality from lung cancer by undergoing annual screening and compared to chest X-ray. Next slide. And that's an example of a low-dose CT scan. Next slide. And this is the U.S. Preventative Services Health Task Force that this year came out with recommended screening annually among those individuals at risk. So that's really what I wanted to get through today, was to talk to you about the disparities, to characterize them, and talk about the importance of screening. What I'll tell you too, though, is to please, you know, like is the sentiment held in this room, that the importance is truly in prevention. The smoke-free policies that we can, you know, look to support, the education that we can look to support to prevent. So I appreciate all your efforts in that endeavor.